First off, starting the day, we have Dr. Mike Hartle. He's a chiropractic physician and nationally ranked competitive powerlifter. He's written many articles on training, rehabilitation, and he treats numerous athletes. He's got a whole bunch of letters behind his name. There's lots and wrote as long as your arm there. Really highly qualified. He consults a lot on injury prevention, strength and conditioning. Okay? He's also the webmaster for USAPL website. Now today we're going to be going over lots of different exercises. Okay? We'll be reviewing the current back exercises that are used in the gym. Specifically, we'll be going over the squat, deadlift, Romanian deadlifts, good mornings, pull downs, bent over rows, one arm rows, seated rowing, glute ham raise, back extension. Anything else? Any other? Lots of exercises today. We're going to be going over to learn their effectiveness in strengthening various muscles, and we're also reviewing the risk of injury that may occur when poor form is used. So everyone, let's give a warm welcome to Dr. Mike Hartle.
Thank you. Well, good morning to you all. Hope you got interested as far as listening to Mr. Bill Pearl. He's someone that I've always admired for a long time and enjoyed his lecture there. As Dr. Greg here explained, actually Dr. Greg, can I have that front sheet there? We're going to be talking about different exercises for the back. Last year when I was here, I talked a lot about trunk stabilization concepts, and this year we're going to kind of go beyond that and talk about some of the gross exercises that a lot of us either do, see, or help train as far as in the gym with our athletes. Now I'm going to be following my notes. If you all have your notes there, I'm going to have a PowerPoint presentation here showing some pictures of our exercises. So I'm going to kind of follow the notes pretty much verbatim there, but you can write notes on there as you need to. A little bit of anatomy of the back and the spine. A lot of us know the anatomy, so I did have some overheads, but I'd rather use the PowerPoint here to describe that. Now, when we talk about as far as exercises for the back, when you look at the skeletal aspect, we're dealing with joints such as your shoulder joint, your AC joint, your shoulder blades, of course your spine, your pelvis, your femur, and your tibia and fibula as far as your lower extremities. It's interesting, people talk, well, how does your shoulder joints get involved with your back exercises? Well, a few of the things we're talking about here today, such as squat, good mornings, bent over rows, you're using your shoulder joints to access that, along with your shoulder blades there. In muscular, we're dealing with prime movers and stabilizers and neutralizers. What we're talking about there, of course, is prime movers are, of course, the big muscles that do the movement. For example, in the squat, of course, you got your glutes and your hams and your quads that are doing it. Those are the prime movers. But you also have your stabilizers and neutralizers. And I'm going to get too much into those today, because that's kind of what I talked about last year. But what we're talking about is things like as far as your multifidi and your rotaries and those muscles, little tiny muscles that are smaller than your pinky finger, that actually helps stabilize those vertebrae so that when you bend over in a good morning to do that, they're holding your vertebrae in the right position so that the big prime movers can do their job, okay? Now, if your stabilizers or neutralizers are weak or dysfunctional, and we've had quite a few people that are talked yesterday about it and also later on today about those, these exercises are going to be bad for you, okay? Because of the fact that those cannot hold those vertebrae in a proper place, you're going to have dysfunction, okay? So we're going to talk about that more later on there. The biomechanics of the back there, of course, we have quite a few different ranges of motion. We got flexion, extension, rotation, lateral flexion, and coupled motion. Flexion extension is generally, of course, as far as bending forward and backwards. General flexion, as far as for most people, is about 90 degrees. Of course, some people, when they come into your clinic or you start training, they can move about 20 degrees or something like that because their hamstrings are so tight. Extension, the normal range of motion is about 30 degrees. And I want you to remember that because we're going to talk about that down the road. Rotation, none of these really exercises deal with rotation. There are, of course, things like medicine ball and Swiss ball and stuff like exercises like that deal with rotation of the trunk. But generally with right and left, you generally have about 20 to 25 degrees of rotation for most people there. Lateral flexion, again, some of these exercises are not going to deal with that. But the interesting is that some of the muscles that deal with lateral flexion also help stabilize the spine. For example, the quadratus lumborum, when they're using both sides, the quadratus lumborum is an angular muscle, comes up from your pelvis up to your ribs. When you use both sides, it's a back extensor. When you use it just one side, it helps you bend to the sides and stuff like that. Coupled motion, what I'm referring to that is that, for example, when you do bend to the side, when your vertebrae rotate, they also laterally flex like that. And the same thing goes, they laterally flex, they rotate. So a lot of times you'll see that. Another thing, coupled motion, is that we deal with the motor unit, so to say, as far as the vertebrae, is that when you're doing like a good morning, you're using that entire spine to do that, even though the lower back and the gluteal areas do most of the work there. So, all right, first thing we're going to talk about is the squat. All right, we're going to talk, the reason I call it the back squat is that we do Also, a lot of front squats in our gym. My wife and I have our own clinic, and we have our own gym there, and so we also do a lot of front squats. I'm referring to the back squat. This is my son. He's 12 years old. He's in 6th grade, and he does a lot of training with us. We don't let him go below 10 reps because of the fact of his young age. We've also noticed we have the Canadian and American flag in the background there. My wife is from Saskatoon, so she is Canadian. So, of course, she said we had to have one in the gym as well, too. So, in the back squat, of course, we're dealing with anatomy such as the quads, hamstrings, gluteals, the adductors, calves, abdominals, erector spinae, and various trunk stabilizers. Okay? Now, in the beginning position here, when you look at the squat here, now Colin here has his feet down here about shoulder width apart. He has his knees, just slightly bent there a little bit, but, you can have them locked as well as long as the muscles are contracted. And he's got the shoulders up, the bar up on his shoulders. Now, Colin, being he's 12 years old, doesn't have a upper back, let's say, like I do, where I can actually bring my arm back and there's a nice little shelf where your rear deltoid can form a shelf for the squat. So he has a bar a little bit higher than that. But that's one bone of contention that I have with a lot of younger athletes doing squats and even people in the gym is two things. One, putting that little foam thing around the bar. That drives me nuts when I see that. And second is having the bar way too high. Okay, a lot of people end up putting that bar almost on the spinous process of C7, your lowest cervical vertebrae. And there's actually been some things in radiology. I remember in school they showed us people had actually fractured the tip of that off by doing heavy squats. So if you're going to use the bar, put it down just a little bit lower than that. And that's where Colin has his. So I'm always spotting him from behind, so I make sure that bar is in the right spot there. Okay? When you want to squat there, you want to make sure that your hands are in as close as possible. You see a lot of people when they're squatting, they have their hands out quite wide, and that does throw off some of the stabilization aspect of your upper body, so you want to have it in tight. When you watch the Eastern Europeans and Russians squat, they really have that bar, their hands in very close. Now, different types of grips. You can use a closed grip. I use a closed grip. Some people use an open grip. So there's different types of grips there. The other thing, too, before you start, you want to make sure your eyes are focused straight ahead or slightly up. You don't want to go too far up because then you'd have too much extension with the neck there. Oh, one more thing. When you're walking back with the squat, I always recommend that people make it a two-part movement. What I mean by that is that when you're standing there, you see a lot of people that just kind of like this, and they stand up and they do this little lurch thing backwards. Stand up, walk back, and then get your feet set. Make it a two-part movement. It's much more safety that way. And when you start getting some heavy weight on your back, or heavy for that individual, say even 225 might be heavy for your client, you want to make sure they stand up and move in the right direction. It'll save some problems down the road. This is the middle of the squat. He's got his eyes still forward right there. He's bringing his hips back. That's the other thing, too, with squatting you see a lot of people is that they don't bring the hips back. Okay? A lot of them drop straight down. Now, you got an exercise like the front squat, for example, you do tend to drop down a little bit straight, but in the back squat, you need to bring those hips back. Now, one of the things you can always tell your people if they're not bringing the hips back far enough is you'll eventually see down here, the heels will start to come off the ground. If the heels are coming off the ground, they're not sitting back far enough, okay? And that's a big thing right there, okay? This is the middle of the squat here from the behind. Again, you'll see his hand placement right there is fairly close there. He's got his shoulder blades retracted. He's nice and tight there. And here's a front view. Another Canadian thing, you see a little Quebec shirt there. My wife competed in the Canadian Nationals in Quebec last year, so we got that T-shirt for him. Now here's the bottom of the squat, okay? He's got good form here. He's got his eyes still up. His shoulders are nice and back. His elbows are nice like that, okay? It's a big thing, especially before you even start the squat, when you're in that rack again, is to get your chest stuck out, okay? Tell your athletes, stick that chest out. Because the other thing, too, even if they have their hands in close, they tend to do this when a heavy weight comes up like that. So if the chest is out and they've already squeezed those shoulder blades together, it's a big thing there. This next picture is my 6-year-old. He loves, he wants to lift as soon as possible, but we won't let him do much. That is actually, this bar right here, to take aside for a second, is a training bar. It's only a 25-pound bar. It's a 6-foot-long bar. I got it through Safe USA in the United States. I think it's about $60 or $70. And it's nice because when we haven't have patients in our office, they can't lift anything, and using a barbell, 25 pounds is quite nice. But Anthony always wants to squat. He gets a squat rack set up. He put his hooks in the bar rack. He knows where his holes are. But this is a position of kind of like when I wrote down here as far as sitting down right there. Well, anyways, you look right down the bottom. He's kind of forward a little bit, and this is kind of like a position you'll see sometimes with a front squat as well. Now this one here, it's kind of a funny picture. You look at his cheeks there. He's kind of blowing out. He's making a little funny face there. But he's sitting down. Now, I'll tell you, that's flexibility right there, okay? Now, your clients, you don't need to go down, obviously, that far. The picture before with my older son, as far as his depth, was fine. I do recommend that people do go down to parallel. One of the things I see a lot is people, especially in high school, is, yeah, I put 500 pounds in the bar, but I went, down that far, and they squatted 500. Problems with that they actually find is that when you do that, it puts a tremendous amount of stress on the knee joint by actually going down to relieve some of that stress. And it doesn't develop the quads and the gluteals as much as it should. The other thing they've done studies, too, as a football players, is that they did a study many years ago, and I read about when I was in chiropractic school, that those football players that did parallel squats compared to football players who did not do parallel squats had far less knee injuries during the football season than those who did not do parallel squats. So it's quite interesting to see that. And one, of course, is the knee ligaments and everything. Another interesting story with that, too, is the fact that I have a good friend of mine who's actually competing tomorrow in Finland. He's the reigning U.S. or world super heavyweight champion, Brad Gillingham. He has no ACL ligament in his right knee. And when I was in chiropractic school, as I got to know him, I did an exam on him, and it's totally fine. And back in August, in Japan, he just squatted 837 and deadlifted 850. So here's a guy who has no ACL ligament, never had it repaired, and his knee is just more stable than people who have ACL ligaments. So by making sure you strengthen those ligaments good, you'll make a big difference as far as your health. Now these are some bad things. If you go down, turn to the next page there, you'll actually see some of the risks of injury. And I also wrote down as far as benefits. A lot of the benefits are similar as far as to each one of the exercises. One of the things I want to talk about there, increased power and vertical jump. Before I ever started squatting, when I didn't start lifting until I was 18 years old, I could never touch the rim. I'm 6'1", and I couldn't touch the rim in a basket, okay? And after starting squatting, after about a year, I could actually touch the rim and almost kind of do a dunk. Not quite very well, but it was interesting with that. We also had another kid in high school I used to train with that he was 5'4", and he had a 39-inch vertical. And he never practiced his vertical, but he could squat 450 at a body weight of 140. So it'd be funny, he was playing defensive back in football, and he'd be running down the field, and the receiver would be like, 6'2", no way. All of a sudden, Brian would just jump and knock the ball out or get an interception. But all he did was squat and deadlift. He competed for our powerlifting team. Now, some bad things you'll see here. Colin here is rounding his lower back. Again, it has to do, especially like when you're not get the chest out when you start. Obviously, this is very injurious to as far as the lower back structures. If you also notice his head is down, I tell athletes a lot that especially when you're squatting or doing a lot of these lifts, when your head goes down, your body goes that same direction. Okay, so he gets up on his toes there a little bit. It's actually interesting when you work with someone who's this young. We spent 10 minutes trying to take this picture. He could not round his lower back like that. And the reason I'm getting at that is that when you start with someone that young, and we spent a lot of time just working with a dowel rod, a piece of wood on his back to make his squat technique very well before he even put weight on there, that we developed his spine, his neurological system so well that he had a hard time doing this, okay? And so it was interesting that when you start training someone well like that they can't do that. So we got the head drop there. Here's another thing you see a lot of young athletes and people do is knees in, okay? We use, of course, a vocal recognition of these people saying, hey, knees out, knees out. The other thing you can do, too, is sometimes we'll take either a nice, one of those big TheraBands or something like that, wrap it around their knees and have them push out while they're squatting, okay? It feels kind of weird, but they actually start to recruit those muscles in the hips to actually get those knees to come out. This is a picture of me. This is another thing I see a lot of in the gyms. You see the feet uneven, okay? You'll see here that my right foot there is turned out. You'll see that the back heel of my right foot is also in front of the left foot there, okay? So you see that a lot with people when they step out. Make sure their feet are even. Obviously in the squat, it's just a one-plane move. It's up and down. But obviously when you see something like this, I'll see people a lot, they actually will develop as far as imbalances in their hips, their lower backs, and their knees from squatting like this. And they may have started out with a perfectly good body, and then they end up ruining it through doing something like this. So pay attention to that. And there's, of course, Anthony at the end there. So he was so proud that he was going to be in this presentation. He was so excited there. This is the deadlift here. Okay, we're going to go to that one. Of course, this works a lot of the same muscles that the squat does. This exercise, unlike the squat's got a eccentric and a concentric part to the lift where it's an up and down. This just has an up part. Of course, you have to bring the bar back down to the ground, but the work is done just coming up like that. This is my wife, Dr. Monique Hartle, and she's showing the deadlift here. Now, generally, we're showing a conventional type deadlift. There, of course, is a sumo type deadlift that competitions do, but for my patients and stuff like that, I'll generally show this exercise here. Sumo is, of course, with the legs out wide and the hands inside the legs. That's what I do when I compete, and that's what she does, too. But we also train conventional as well, too. A couple things about this, when you look at it, she's got her head up, she's got her chest stuck out, her hips are a little bit above parallel, but that's fine. Everyone's a little different. My son Colin has long legs but a short torso, so his hips are way up. On the other hand, I have a long torso and short legs, so my butt's way down in the deadlift. The other thing, too, is you look at the hand grip there. Now, you've noticed in the deadlift, in a lot of these moves, you use an alternating grip. Okay, one hand's pronated, one hand's supinated. Big thing I tell people, and this is something I learned kind of the hard way a little bit over a period of time, is switch your hands. I don't care if you switch them, workout to workout, every other set, or whatever, but switch your hands, because you can see a lot of when I work on a lot of the world level and the national level powerlifters, you can see actually these changes in their backs just from years of having one hand forward and one hand like that, and it actually starts to cause rotation in their spine. So I tell people, rotate your hands, okay? It may feel weird. If you get a person who wants to compete in powerlifting or something, they may have one grip they like the best, that's fine. But if they spend all their time training, 98% of the time they have their hands rotated, then do that. The other thing I do a lot is I've gotten into, and my friend Brad actually started doing a lot of too, is utilizing what they call the hook grip, which I don't know if you're familiar with, but a lot of Olympic lifters use that, where you have your hands like this around the bar with both hands, and you actually bring the thumbs in, and then you hook it like that, okay? It's kind of a unique grip, and I recommend you read a little bit about it before you have someone do that. It does cause a little bit of discomfort to the skin. I have a nice little calluses on my thumbs from doing that, but that's taken time to build that up. Okay. The kid in the side view here, okay, she's got her back nice and flat, head up there, okay? And if you also think, the other thing you want to notice too is that her shoulders, her arms are straight up and down there, okay? One of the things I want to tell people is that we'll show a little slide here is when their shoulders come forward there. This is the middle of the lift, and this is, of course, the end. Now, when people end the deadlift, I recommend you don't sit there and, rock way back. And again, we talked about the normal range of motion of the spine and extension is 30 degrees. The rules of powerlifting, you have to have the shoulders erect. As far as for training clients, I just want them to stand up with it. They don't need to bring their shoulders all the way back like that, okay? This is a bad part of the lift. Of course, my wife is exaggerating a little bit here, but this is actually not funny because I do see a lot of people do this. You see it at the national level. Matter of fact, our U.S. 275-pound champion last year, he's got form like this, but he still deadlifts 800 pounds. And I told him many times, he's got to change that. And of course, they don't quite always listen. When they win, they think they know everything a little bit. But Pat's a great guy, and I like him a lot, but he needs to change that. Second thing I'll see a lot, too, is with young powerlifters or young athletes that do this in the gym, they don't have a good enough trunk control to hold that. And when you see something like this, you need to work on that trunk and those stabilizers to get those vertebrae in the right position. Especially, too, in the upper back there, between the shoulder blades, they need to really work on that aspect. And, of course, you can understand how this would be quite damaging to the lower back structures. This is a start as far as leaning forward like that. She's actually leaning forward. You'll see a lot of lifters will do that. Sometimes you'll see it, they'll set up like that. And sometimes you'll see them where they actually will start right, and then right before the bar leaves the ground, they'll actually lean forward to come up. And that puts a tremendous amount of stress on the lower back. The other thing, too, is it makes it harder for the lift because when you come forward, you also have to come backwards. Because the lift is, as far as when you finish at the top, you eventually have to finish that lift, so therefore you have to overcome more distance there. Okay, Romanian deadlift. This is actually one of my favorite exercises. Brad, my friend, turned me on to this, and after doing some reading on it, I really like this exercise. Why they call it Romanian deadlift? Hey, maybe it was designed in Romania, I'm not sure, but someone gave it that name, and everyone calls. We also call it RDLs for short. Basically, the movement starts as far as at the top. It's like a deadlift. So basically, if you have someone, I'd like to do this in our rack that's behind her. I just put it in the hooks there. Otherwise, you can just deadlift it off the floor like we just talked about. Okay. This is the middle of the lift. Now, in this lift, you want to have some knee flexion, about 5 to 10 degrees. Okay. The hips need to go back, so the weight almost, as far as in your feet, will be between your arch of your foot and your heels. And you got to keep your shoulder blades contracted. So what I'll do a lot when I'm starting this lift is before I start, is I'll stick my chest out, all right, tighten my abdomen, and then keep my head up and bring it all down. And what the movement's supposed to be is the shoulders should not drop. And I'll tell you what, when you do this exercise right, you will feel it not only in your hamstrings and your butt muscles a little bit, but you're going to feel it between your shoulder blades. And this is what I was talking about earlier, how the shoulder blades and the shoulder joint gets involved as far as with these exercises. And for doing a lower body exercise, it works your upper back. So I recommend that people, too, don't do this the day before you're going to do a bench workout. Because your bench workout, especially if you want to try something new or a new personal record, you're not going to get as good of a bench because your upper back's going to be tired, which when you're benching helps stabilize it when you're benching or doing other exercises like that. Now the next one here Shows her at the bottom here. Okay, it looks like she's got a little bit of a hump on her upper back, but that's actually a little shadow behind her, so I just wanted to share that with you after I looked at the picture. But at the bottom here, she's got her knees just barely bent, her hips are back, and she's got a nice flat back there. Okay, what I usually tell people in this exercise, go to the limit of your hamstring flexibility. Okay, so for some people, you know, that might bring the bar comes to above their knees sometimes, and you can almost tell by the end of the set you get more flexible as the muscle gets warmed up. You know, I can get down to about right here, but sometimes at the beginning, especially if my hamstrings are a little tight, I'll get down to basically just below my knee there. But you want to you go to the point where your hamstrings are straight, and the same thing too is have a training partner watch you. You want to go to the point where you're still safe. Okay, and we'll show you as far as some things that don't look so safe. This is what I see some people do. They almost want to turn into a stiff leg deadlift, which is not what we're doing. So the back rounds like that, the head drops, and also the other thing too is their hips are forward. The biggest thing here, and I'm going to stick my booty out here, is that when you're doing this exercise here, you want to stick those hips back. Okay, if your hips are coming forward, that bar travels too far forward, so that you want to get back on your heels and stick your hips back like that. And that's a big thing that people don't do. When you stick the hips back, you actually get more tension on the hamstrings. So that's what we're doing there. The other thing too we'll see a lot of people do is they actually flex their knees too much and they turn it into a squat or a deadlift. Okay, so also they'll get down to the bottom and they'll come here and then they just stand up with it. Well, it doesn't quite put the stress on the hamstrings and the gluteal muscles like you want to, and plus she's also rounding her shoulders again there. Okay, good mornings. And I already said that to you earlier. This exercise has got a lot of good press and a lot of bad press. Bad press we've heard from a lot of orthopedists and people like that. I've even heard from people in my profession, doctors of chiropractic, who said it's a bad exercise. But I've also heard as far as things like a lot of you heard of Louis Simmons from the States. He talks about uses good mornings all the time, different kinds, and we do a lot in our office too. One of the things about good mornings that, again, I said earlier, is that if your back, if the vertebrae aren't strong enough, then you are going to have a problem when you do this exercise, because it does put a lot of load on the lower back. But I'm also a firm believer that if your body is strong, you can pretty much do anything as long as it's good form. Okay. One of the things that I heard about a long time ago was there was a study done of migrant farm workers, I think in California, and one of the things was that these people are people who are bending over in the fields all the time. You know, so they're leaning over all the time. They had no back problems. One of the reasons was because they developed their ligamentous and muscular system so strong that they were able to accommodate as far as doing that. Okay. Whereas you take the average computer nerd like myself or something like that who's not a power lifter, and he goes and tries to do this, he's going to have problems. So make sure your client or patient is strong enough to do this, and that's where doing things like Romanian deadlift might be done first, or doing some hyperextensions. We'll talk about that in just a second here. The good mornings start just like the squat. Now, for me, one of the things I find when I do good mornings is that the bar isn't actually big enough for me. So what I ended up doing was I bought a bar from Iron Mine Enterprises in the States called a Buffalo bar. I don't know if you're familiar with that. And what it is, a regular bar is about 7 feet long. A Buffalo bar is 7 feet 6, and the bar is actually bent. You're actually buying a bent bar, which and it's actually more expensive than a regular bar, but it's thicker. And one of the nice things about it, and people like Louis has actually done, is he's actually bent bars on purpose, but I went ahead and bought one. And what it does, it has a nice rounded thing, so I can actually put my hands out a little bit wider, and I can actually, it curves because of the contour of your upper back, so it's a little bit more comfortable. But generally, I mean, my wife and my kids do it with just a regular bar, and that's fine. Start it like the squat. Of course, before you begin, make sure your chest is out, your abs are tight. We're bending over. Very similar to the Romanian deadlift, you are bringing the hips back, okay? You're doing some knee flexion. I remember back in the 60s and 70s, of course I was a kid just born then, but I remember hearing stories of people doing good mornings with straight legs, okay? They've also done studies too, and they found that most people who blow, if you want to use a simple term, blow their back out, is because of the fact that they're usually bending over with straight knees. Very rarely does someone blow their back out with their knees slightly bent, okay? So I'm not talking about, of course, blowing your back out doing a good morning, since that's not what we want to do. But I want to keep some knee flexion again to put some tension on the hamstrings. You're pushing the hips back. Now she's keeping her eyes up at this point, but when you get down to the bottom, you're not going to be able to keep your eyes up because you're going to have too much extension with your head. But keep your chin in line. Don't do the chin point thing like you see a lot of people do. Good mornings at the bottom here. And now she's probably about, maybe from the top, maybe 60 degrees. I usually tell people don't go beyond as far as parallel to the floor. There are some people who have fantastic hamstring strength, and therefore they can do that, but I just recommend staying at that point. The other thing you can look for, too, is when you start to see their lower back not keeping its lordosis, or the curve in the lower back. When they start to lose that, then you need to have them come up. The same thing with the Romanian deadlift again. Now, one of the things that we find a lot with athletes, and I'll talk about this with the Romanian deadlift in this exercise, is that when you strengthen the hamstrings, let me actually back up. A lot of people, the quadricep to hamstring ratio should go 1-to-1 as far as what their strength ratio should be. That's what most of the research shows. And most people are usually 3-to-1, meaning their quads are too strong compared to their hamstrings. And that's where I was talking earlier about doing those half squats versus a full squat. Because when you do a full squat, that's when the hamstrings really come in. The other thing, too, that when you see this is that the adductors, especially the adductor magnus, which if you look at your anatomy text is one of the largest adductor muscles, is a very powerful hip extensor, okay? And they've done some EMG studies and some MRI studies, and they found that the adductor magnus is very active, almost more active than the hamstrings are during a squat, the good mornings, and the deadlifts and things like that. But when you increase the hamstring strength, you also, with that client, possibly if they're especially a sprinter or a football player, increase their running ability too. Because the stronger the hamstrings are, the stronger and the faster that person will be able to be. And we've seen results of that in our gym as well too, because we have a bunch of high school kids that train with us. So we've seen that results. The other interesting thing too is that, and we talked about this last year in my presentation, we don't use belts in our gym, okay? I compete powerlifting without a belt, and so does my wife. But of course, we do that after training our trunk very well. But one of the things they find is that the bicep femoris, which is one of your hamstring muscles, of course, ties in all the way up to your stomach muscles through the sacris tuberous ligament, which is a little ligament that's in your butt about this long. And that ties up into your glutes, which then goes up into your back muscles, and of course helps with your, as far as your intra-abdominal pressure and your thoracolumbar fascia. So training those hamstrings properly will help as far as your lower back becomes stronger as well too. That's why I like this exercise a lot, because it does that. Okay, my wife really appreciated me taking this picture of her. Actually, I asked her, and she said she had no problem. But and this is interesting. Let me tell you these pictures. These pictures are 3 weeks after she gave birth to our third child. So she's actually doing pretty good here. Bad things about the good mornings, or some things, not bad things, but things you'll see. She's shifting, if you notice, over to the right. Some people, as they have some muscle imbalances, you might find that, say, one hamstring's tighter than the other. So as they go down, it'll start to twist on the pelvis. You'll see that. Her feet are offset a little bit, and she's also twisting the bar. It's lower on her back to the left. I used to do that a long time ago. One of the reasons I saw a doctor of chiropractic is because I had a herniated disc in my lower back that he fixed. But I used to do this as far as twisting there. And, of course, my training partners had no idea why I was doing it. Just thought it was part of the lift or whatever. But obviously it was because I was compensating for a problem in my back that was soon to show up there. So, and, of course, this is another thing you see a lot, is that they'll get to the person will go down with great form, keep the lordotic curve, their lower back is nice and tight, and all of a sudden they start to come up, and, of course, some of those muscles are weak, so they tend to drop the head even more around the shoulders, and, of course, around the lower back there. As far as when you do hand spacing on the bar with the good mornings, you have to generally go out a little wider, because when you're squatting, you're generally in a more of an upright posture. When you're leaning forward, you put a little more stress on the shoulder joint, so you have to put your hands out a little wider. But when I say that, again, you got to make sure those shoulder blades are nice and tight. You got to squeeze those shoulder blades, because the wider your hands go on the bar when you're squatting or doing any type of movements, your shoulders tend to do this type of thing. Okay, so make sure that person keeps those upper back muscles nice and tight. And again, that's a static contraction, but it helps with lifts like the deadlift and Romanian deadlift. And again, will also translate to other things too. One thing about pull downs that I have a big contention with a lot of people is when they talk about behind the neck pull downs. I haven't done them for years. I don't have anyone in our gym do them. If they do them, I make them do push-ups. But one of the big reasons is two things. One, most people when they do behind the neck pull downs, their head goes forward. Okay, a lot of stress on the neck there. The other thing too is that their shoulder blades their arms tend to do this just to get the bar down, and they start to cause internal rotation on the shoulder, and that puts a lot of stress on the shoulder joint. So I recommend, and even though the only way I'll let people do that, which is very rare if they're not working out in my gym, is if I check their range of motion first. If you get someone who's a Gumby or something like that, they can probably do behind the neck pull downs in a safe manner. But those shoulder blades have to be back, the head has to stay upright, and they're not leaning forward. Most people can't do that. So we do front pull downs. We do all sorts of type of different front pull downs. And this is what she's demonstrating here. Now she's using a flat bar there. You can use many different bar handles. We'll talk about that with cedar rows as well too. And even in this bar here, I'll alternate the grips as far as, supinated and pronated. We'll also talk about as far as the width of the grips too, because that'll hit different muscles in your back as well. Okay, this is the bottom of it. She's touching right about her collarbone, maybe a little bit below that. Her head is nice and straight. She's leaning back. And I wrote down in my notes here, yeah, about 0 to 45 degrees from vertical, just depending upon where you're hitting there. One of the biggest things you see a lot of people do, though, is as they doing the pull downs, is that they will kind of lurch and jump up and almost kind of trying to do a power clean or something with the bar. Stay nice and tight. Keep your abs tight, and you'll get more out of this here. Okay, so that's a side picture. That's a back picture of her there. She's got her hands right at the bend there. If you also notice, too, she's got her elbows nice and back. She's got her arms extended and her shoulder blades retracted. One of the biggest things you'll see in these exercises, the next few that I'm going to be showing you, is that people do not know how to retract their shoulder blades. Okay, most people know how to extend their humerus, your upper bone here, back like that, no problem. But we see a lot as far as even with swimmers, that when they lose the ability to keep those shoulder blades nice and back and nice and tight. And when you do that, you affect the entire shoulder joint and upper back there. Okay? And so we will work, very hard on people to coordinate that, is that when they extend their humerus, their shoulder blades need to come back at the same time. And this is one exercise that's really good for you to do that. But if you are doing that, make sure you use lightweight and high reps, okay? Because a lot of people, especially with our computer age again, and people who do a lot of sitting, we tend to do everything obviously in front of our body, so we tend to get this rounded upper back type posture. Okay, so we get very tight across the pecs here, the fascia in front here gets very tight, the upper back muscles get very weak and they get stretched out. So a lot of times, a lot of shoulder problems in our office, it's not so much as far as not only we treat them chiropractically, but we also knew, my wife and I are also certified in the active release technique that Dr. Leahy's talking about. But we'll do that, but also work on restoring these normal motor patterns, okay? Because for them, this is normal. And you may not only see this in benchers walking around the gym, hey, what's up, man? They're walking around like this, and their hands are all turned in. But you'll see that with people who do a lot of work, like I said, sitting at the front here, or driving. People tend to lean forward, do a lot of stuff like that. So you need to work in training them to actually bring it back. One of the, actually Indiana's swimmer of the year, she's a patient of ours, but she was like this close to having shoulder surgery, and her mom brought her in to see us. And I asked her, I said, stand up. And this is her standing up. I mean, and this girl is, in a couple of years going to be Olympic caliber. And she could not. I asked her, bring your shoulder blades together. And this is as far as she could go. She could not even get it back to neutral. So when she's doing the front crawl and she's doing the backstroke, which is her two main events, how can that, as that arm is coming around, that shoulder blade isn't even properly stabilized on your thoracic wall or your trunk to allow the shoulder joint even to function. So I told her, we got to get that shoulder blades back. And now she's to a point where she not only can get neutral and stand there, she can actually get it back a few inches. Okay, not as far still as I want to see it. But we have her doing a lot of these exercises. I have her doing Romanian deadlifts because of the fact that not only is it going to make her, force her to keep those shoulder blades back, but then it's also going to work her hamstrings, which is going to help her kick as well too. But I want her to keep that static contraction on the way up and down with the Romanian deadlift. But it's a big thing and a big problem with a lot of people is not having the ability to get their shoulder blades back. Now this is kind of what I'm talking about here. And you're going to see this in the next few exercises that a lot of people tend to do the same thing. The shoulders are elevated, which means they're like this. And then they're not minimal scapular retraction. They can't bring those shoulder blades back. Okay? And so you can see with her, like I was talking about the behind the neck pull downs, where the arms are starting to rotate like that, causes problems. The biggest thing you see a lot, not only with the retraction of the shoulder blades are bad, but also people elevate their shoulder blades. Okay? When when they're activating their traps, and we don't want them to activate their traps, your trapezius muscles get a lot of activity as it is. Just carrying your book bags and your suitcases to the hotel today, they got a lot of work. Okay? So we don't need to really work that. Matter of fact, we don't really do a lot of shrugs in our office, which is an exercise I was thinking about talking about. But these are some of the main ones we do. But when you elevate those shoulder blades, they tend to come up like this instead of bringing it back. Okay? So I always tell people, bring those shoulder blades back. And one of the best ways, as far as even vocally telling them, stick your chest out. If you stick your chest out, you don't really raise your shoulder blades. You just go like this. You're sticking your chest out. Okay? And of course, when you do that, watch as far as extending the lower back. I'm just talking about the chest there. But stick your chest out. And for, when you work with a female, don't be afraid to tell that to them, because I know some people may be a little concerned as far as sticking their chest out and looking weird in the gym or something like that. You got to do it. I don't care if you have breasts or not. You got to do it. Okay? And I'm not trying to be funny or anything, but you got to say that to them and get their chest stuck out there so they can get those shoulder blades down and back. Yes, the other thing too I also use too is I will tell them, bring your shoulder blades back and down. It's almost an angular type motion with the way the shoulder blades go. Okay, bent over row. This is one of my favorite exercises too, because this one causes you to do many different things. The main thing it does, of course, is work your lats and your back and upper back and your middle back area. But when you do it with a barbell and you do it properly, it can actually also put a static contraction on your hamstrings, which is also going to not really work them, but put a contraction on, and your butt muscles, but also as far as when your lower back trunk stabilization. Okay, and I'll show that in a second here. I call this a pre-start because with her, she's just starting with the bar and the rack. Of course, if you start with it on the floor, you need to deadlift it off the floor first, obviously, to get to that area there. Okay, this is the start motion. Okay, so she starts with the bar at her knee. She's over about maybe 35 degrees. You can go anywhere from 0, and I think I wrote it down here. Yeah, anywhere from about 10 to 45 degrees above horizontal. You want to establish a flat back position. You want to tilt your head forward just a little bit. Again, I like to see people keep their head in line with their body, okay, instead of fully extended back like that. So she's got her chin down there, okay? And then you want to lower the bars until your elbows are fully extended there, okay? Now, as far as here, you can also use different widths of grip, too, okay? And as far as if you, I recommend, we don't use any straps at our gym, of course. Being powerlifters, we have to have a good grip for our deadlift, so we make sure we work that. But you can also use straps too, because this exercise is not really meant to work your grip. So if you have no interest in working your grip, then use some straps or something to do that. But I'd recommend keeping your hands in the same position. Unlike the deadlift or something where you may you have this here, you are trying to work the back muscles in an even way. So have the hands like this. If you have to use straps, go ahead and use them. But we also, always have it narrow, medium, and wide grips on this because that will hit your upper back a little bit differently there. If you look at the anatomy involved here at the bent over rows, other interesting thing here too is it says it works the triceps. A lot of people go, how the heck does that work? Well, the triceps, the long head, which comes across your shoulder joint, one of the 3 heads, actually is an extensor of your arm. So a lot of times if you work heavy triceps before doing this or pull downs or any type of rowing exercise, you're going to find that you may have to use a little less weight because you're tired, okay? Even though it's not a big contributor to it there. Now, the other thing, too, is when you do this exercise, again, I talked about the trunk stabilizers because as she's bringing the bar up to her, she has to hold that position. So she's holding that leaning position over. So those multifidi and rotary muscles are holding those vertebrae in place. When I have people with facet problems, with people with disc problems and stuff like that, as we get through the pain and get rid of the pain and we start correcting the problem, then we actually I use this exercise quite a bit. And I'll tell people to use a broom handle at home or a dowel rod or something like that. Because just the action of having to lean over for, let's say you're doing 10 or 12 reps, it might take you, a minute, minute and a half, 2 minutes to do those reps. When you're leaning over like that, your muscles have to contract hard to do that, okay? Again, we're not trying to elicit any pain here, so make sure that the person's not in pain when you're doing this, but it's a great exercise for that. Now, the other side of the coin, there's also bent over rows that I've done in the past, which I'll use a lot of weight with. And I would call those cheap bent over rows. Okay, those are not ones where I'm trying to, really work. I'm trying to get a lot of weight, trying to get a lot of weight moving. It does help as far as my middle part of my deadlift when I'm competing in powerlifting. But I like this exercise because when you do it this way, it actually really works your upper back muscles, whereas that tends to work more of the whole unit of your body. It's kind of like a half, if you want to say power clean, as well up to your abdomen there. So this is some of the bad things about the bent over row as far as some things you'll see. Again, she's elevating her shoulders. The other thing, too, is she's got minimal scapular retraction. Again, her shoulder blades aren't squeezed back enough. If you look as far as the risks of injury there down in this exercise, you'll see I put down arms out wide. A lot of people have the arms out wide like that. And what happens when you do that, of course, is that you tend to elevate the shoulders. So I tell people to try to keep those arms in nice and tight, around a 45-degree angle or less. And, of course, it depends as far as how your grip is on the bar, too. Because if your grip is narrow, it's easier to keep your arms in tight. If your grip is out wide, it's a little bit harder to keep them in, but that's where you really need to work on that. But you will find by doing by the 8th or 10th rep, if you're doing that many reps, that you'll find that the person starts to get tired, they start to cheat, and the shoulder blades may not come back as far, and the shoulders start to elevate and stuff like that. So make sure you try to coach them into not doing that. The other thing we'll do, too, and again, you can use this on these different back exercises, is what you can do is you can actually take your hand like this, create like a knife edge, and put it on their spine, between their shoulder blade. And what I'll tell people, I'll say, squeeze my hand. And sometimes when someone doesn't quite know how to bring their shoulder blades back or they're not bringing it back far enough, when you put your hand on their spine, you're giving a tactile response. You're touching them, and that tells them, okay, hey, I need to do something here. And so they'll actually really try to squeeze the shoulder blades and try to squeeze your hand, okay? I tell them to try to hurt my hand there, so that's a good way of telling them to do that. Okay, one-arm row. We don't do a lot of this exercise. Of course, in the sport of powerlifting, this isn't very, doesn't carry over very well. But it is an exercise a lot of people do in the gyms. It's a good exercise. You don't really need a spotter. But there are some things that you need to talk about as far as to do this right here. One of the things you'll see here, her head again is in line with her body. Her back's nice and flat. She's got one knee up on the bench there. She's got one leg down on the floor. My wife is only 5 feet tall, so her leg on the floor is actually just barely bent there. If I was doing the same bench, my knee would probably be bent more. She's got one hand on the bench there supporting. Her arm is hanging straight down there, and she keeps the dumbbell in a position with a neutral grip like that. Okay, this is just a front view of it. See what it looks like there? Okay, and here she's bringing it up there. Again, one of the things you want to do with this exercise, you want to keep those arms in nice and tight. Okay, you want to bring it up there. You want to squeeze the shoulder blades. It's a little bit harder in this exercise to squeeze the shoulder blades because you're only using one. But still, you want to visualize in your head or tell your client or patient, hey, bring that arm back, bring that shoulder blade back. Okay, and you can again put your hand on their spine to have them do that. Okay. One thing I want to talk about with this exercise, and it carries over to the bent over rows and also the seated rows in this, you can do what they call a tempo, meaning that you can just do a regular type bent over row, one arm row, or you just bring it up at a normal speed. But sometimes, especially like with the bent over rows or this, we'll work on a little bit of stabilization, is I'll do what we call a tempo, meaning the speed of the lift. And what I'll usually use 3 numbers. I'll tell the patient I want you to do 202. And what that means is I want you to take 2 seconds to bring the bar up, or in this case, the dumbbell up. 0 means don't pause it or stop it. And then this last number, 2, would mean as far as how long you take it to go down. Okay, so in that lift, if I say 202, that means as far as it takes 4 seconds to do that lift. Okay, when I do the bent over rows, a lot of times I'll do a 303 where it takes me 3 seconds to bring the weight up, don't hold it, and then bring it 3 seconds on the way down. And I'll tell you, bringing it 3 seconds on the way up isn't hard, but trying to do 3 seconds on the way down, especially when gravity, people just want to let that bar go down. But your muscles, again, are fighting to do that. So if you're doing the bent over row and you're trying to keep your shoulder blades nice and tight and not round your shoulder blades, by bringing it down slow like that, you're able to do that and get more of the trunk stabilization and working on those muscles there. So we'll do that with those exercises there. Okay, this is a bad thing you'll see, especially when I see this probably more in guys than girls, and I think it's more due to the hormone testosterone. But when they start getting those 90-pound dumbbells in their hands and they're really cranking it, they bring the dumbbell up and the trunk starts to rotate and the shoulder blades are elevated, the arms out wide. You're not really getting anything when you do that. Okay, and I think it's the biggest thing I want to impress upon you is that, we in our gym, we really stress technique before strength. Okay, because I'll tell you what, if you add strength to bad technique, you will get hurt. I guarantee that. And I think all the doctors in here would attest to that. I've seen patients like that. But when you use bad technique with strength, and like I told my friend who deadlifts 800 with bad form, someday he's going to need to see someone like myself. He lives in Wisconsin, so he can't see me, but it will happen. And it's just a matter of time for it to happen. It'd be one of those situations where he'd get done doing, say, 700 for 6 reps in the gym, go home, go out for a date, drop his brush on the floor and pick it up and blow his back out. And you sit there and go, how the heck did that happen? Well, what happened is that when he's deadlifting, he's using all those gross prime movers to really squeeze down and tighten up that back. And for the weak stabilizers, it takes over for them in most cases. So when I go to powerlifting meets, I very rarely see athletes get hurt at the meet. It's usually in training or usually at home after training. And in this case, when he picked up that brush, Pat's a strong guy. He doesn't have to lift, 800-pound brush. He just got to pick up something that weighs a couple ounces. So he's just relying on his multifidi and his stabilizers in his back to help him support his spine. In a lot of cases, because they're already weak, it goes. Okay? I'm sure a lot of you have probably heard of that, of people doing it. Well, how can a strong person do that? And it happens because of using bad form.
What about the dumbbell row where the guy I've seen in the gym on an angle like this row?
Well, he's talking about as far as his upper body is more like a 45 degrees, what you're talking about?
I see some guys laying on the dumbbell rack.
Right. Well, you're getting some other muscle groups involved there too. I mean, you're getting some of your deltoids in there. You're trying to, because you're obviously supporting the weight. Because you think the way gravity works. Gravity obviously works straight this way. So if you're working this way, then you also have the muscles that are trying to keep that dumbbell here instead of plopping down. So you got front deltoid and some of the pecs and stuff like that. As far as I'm concerned, there's other exercises for that would do better. I'd rather concentrate just working on the back muscles than having to do that.
Okay, so that just strengthens. Because I've told them, if you want to activate more back muscles, they got to get back.
Right. Like you saw in the picture, you almost want to be where the back is almost horizontal. I mean, because of her arm leaning on the bench, she was elevated just a little bit, maybe like 5 degrees or something like that. But yeah, when you go forward, like there's other exercises that are better for, the bench press, for example, is better for your pecs and your front delt than doing what you were talking about there. So, yes?
You're stating here, under risk of injury, extending up arm with no scapular retraction. Are you talking that when you're bent over in full extension, you have to keep the shoulder blades back so you don't let the shoulder fall forward?
Well, that's what you're talking about, the one-arm row here?
Yeah.
Okay, and that actually I have that written underneath a couple of the exercises, that same statement there. What I'm talking about there is that when you're extending the arm, okay, so the humerus here is in neutral position. This is extension, this is flexion, okay? So when the arm comes back, the person is not taking their shoulder blades and retracting them, okay? And that's what I was talking about earlier about doing a coupled motion where at the same time that the arm extends, the shoulder blade has to come back. And I've had some people say to me, well, why don't I train it where I bring the arm back first and then squeeze the shoulder blades? Well, that's not really how the body's supposed to work. It's like doing a squat where you go down and then quickly bend over with the knee straight and then stand up like that. You don't do that, okay? It's a normal motion to go up and down. So what I'm talking about there is just bringing them back together all at the same time.
Now, my question is, what about when you're starting the motion down here? Do you let the shoulder fall forward or do you keep it back?
Well, and we're going to talk actually about that in the seated row here too, that as long as you keep the trunk nice and stable, I don't have as much of a problem bringing the shoulder blades a little forward, a little bit of protraction or bringing them forward, and then finishing it. But as long as the athlete or person can bring it back, some people say you got to keep that arm nice and back like that, but I think you need to develop that whole range of motion because when you're, say, working with a baseball pitcher or softball, the arm is coming forward like that or throwing forward, so the arm is protracting. So you also have to keep it more functional too. That's where I like to look at that there. Does that answer your question there? Okay, seated row here. A lot of times you'll see it on the floor, which is the way our gym is. Sometimes you'll see it up on a little bit elevated bench. But you want to have your feet like that. We do have a little bit of minimal knee flexion there. It does tend to take some stress off the lower back. If someone's got a bad lower back, this is usually not an exercise to give them because sometimes it is kind of hard and sometimes their hamstring flexibility, especially someone who's very tight, doesn't do this, can't do this very well. But for most people, this exercise is very effective. If you notice in here, she's using a angled handle, okay, one of those kind of a triangle type handle. Again, you can use different bars with this. You can use flat bars, and again, you can put different grips on that and wrists, all sorts of different exercises there, types with that. This is the end movement there. She is leaning back just a tad there a little bit, but I usually have people go to between that and straight up. She's bringing the cable straight to her abdomen there. She's got her chest stuck out. Her chin's in line with her body there, and her knees are just slightly bent there. And that's really good as far as motion. And here's kind of what I was talking about earlier with the pull downs too. She's got her, you see this, I see this more with this exercise almost than almost any other rowing exercise, is the fact that the shoulders will elevate like that and the shoulder blades will also not retract. So again, this is a big exercise. The swimmer I was talking about earlier, when we started her doing this, she couldn't do this worth a darn. I mean, I told her, I said, you suck. I mean, I really much told her that right to her face, you can't do this. But this is one of the reasons why she's having problems with swimming. So she now can actually bring her shoulder blades back, and when she trains with us, I still harp on her as far as keeping that. She likes it when I'm out of town like this, because then she can train with Dr. Monique, and she's not as mean a person as I am, I guess. But I also know what she's capable of as far as her future, so I want to make sure that she doesn't have the shoulder surgery. I mean, last year her pain when she came to see me was 10 out of 10, and now she's down to about maybe 1 or 2 out of 10 with just the right shoulder, left shoulder is completely gone as far as fixed. So she's doing very well with that. So, all right. And a lot of things, like I said here, you can use tempos. As far as if you want to have someone do slow, I've done that before, where we'll use, say, a 3-1-3 tempo. You can all use very different variations of that, where the person will take 3 seconds to pull it to them. They'll have to hold it there for 1 second and then take 3 seconds to relax. And I'll tell you that when you really want to mess with someone's mind, give them a 3-1-3 in the seated row. There's not a lot of movement with it. And for take 3 seconds to pull it to you, it seems like an eternity. And then the 1 second to hold it and 3 seconds to bring it back. But I tell you what, it will really, really work on getting those scapular retractors, those upper back muscles, your rhomboids and traps, lower traps and middle traps, to really work well as far as to do that. And of course, here she's leaning back way too far. You see a lot of people tend to do almost a pseudo Romanian deadlift or a good morning with this exercise, where they'll pull it. And this is another thing this lady was talking about here too, is they'll bring the arms back, they won't squeeze their shoulder blades, and then they'll lean back, thinking that somehow leaning back makes up for not squeezing their shoulder blades. So it'll turn into a lower back exercise at the same time of that as doing an upper back exercise. So you want to make sure that they're, like I said, the earlier photo she had, it was just leaning back just a little bit, and that's fine with me, but as far as when they're leaning back this far, it's not really necessary. Plus, they tend to not have their shoulders back as far as they want. And again, you can put your hand on their spine as far as a knife-type edge contact there to make them concentrate on squeezing your hand. Okay, this is a glute ham raise. This is an exercise that's become more popular over the last few years. This is the one that we have in our gym there. When you're doing this exercise, because the same machine, we also do hyperextensions and those exercises as well too. But you need to have that little rounded piece to it to be able to do that. You do also, this one here, I really want to go over as far as the form there. If you looked at, she's positioned the legs so the knees are slightly below the thighs. Okay. You also want to have, as far as the hang the torso down at 90 degrees, and your hips should be off the thigh pad because you need to have that so you can get a good range of motion. Okay. She puts her hands behind her back. I take my hands, I stick them in my armpits. You do whatever you want. If you do get to a point where as you become stronger with this exercise that you want to hold some weight, of course you'd have to hold some weight here or put it up behind your head. Of course, when you do this exercise, and I'll show you in a minute, when she gets all the way up, having the weight behind your head might be a little difficult to continue to hold there, especially if you have a 45-pound plate or something. But this is a great exercise. One thing, too, I want to put as a side note, do you see that little hump there where she's got her pelvis over? One of the things that I do at our gym, and this goes back to as far as your upper back and people doing a lot of sitting at computers where they round their shoulders quite a bit, what I will do before I bench, squat, deadlift, anything I do in the gym, is I will actually lean backwards over that. Okay? What a lot of people tend to lose in their middle back area and their thoracic spine is they lose the ability for that area to extend, because that also can extend in addition to flex. And so that will get very tight. Of course, it also, being the pec fascia and stuff like that, will make it very tight. What I will do is usually, this machine is not really where it is right now in this photo, but it's in a different part of the gym, and I have a bench there where I put my feet up on, so my knees and my hips are about 90 degrees each, and then I lean over that, and in the middle of my back is probably about the middle of the top pad there, and it really works well as far as stretching. Another way we do it with patients is I'll have them take probably a lot of you have heard this, take a big bath towel, roll it up really tight, and I put some tape around there, and they can actually lay on their back on that and let them relax over that. And that will help more as far as per segmental aspect as far as helping that. I used to do that, but then I really squished the heck out of the towels. Weighing 275 pounds, it doesn't really do very well for me. The other thing we'll do too is, you ever seen those things that kids have in pools, those fun noodles? Okay, that's another thing we'll also use too. But you got to get the thick ones, anywhere from 4 to 6 inches as far as diameter, and those will also work well with patients too. A little bit thicker than a towel. Again, I tend to squish those things so they don't work very well, but for most of my patients, they seem to work quite well. I am trying to come up with a design to actually incorporate something like that and have it at home so you don't have to buy a $600 machine here to lean over. And it's something I may hopefully get done here in the next year to design something like that. Okay, this is a glute ham raise. This is the middle part. Okay, it looks right here, it looks like a hyperextension. Okay, but it continues beyond that. So she's going from the leaning position up to parallel. And if you notice, she's got a nice straight line pretty much with her body there. Actually, I think I caught her right before she got to that point. And then we go to the next picture, and this is the top. Okay? The biggest thing here, and this is what I was talking about earlier, if you tend to hang a weight behind your head, obviously you can see that gravity is probably going to fall. So what I do is I put the weight in front of me here. Another way some people have done is they've actually taken some of those things like TheraBands and stuff like that, or other rubber bands, and wrapped them around the bottom of if you can kind of see the front of the glute ham on the floor there, and wrap it on the bottom and somehow attach it to their upper back. Don't, of course, hang it on your neck, and then obviously go up with that. And obviously, the further you go, the more resistance you're going to get as far as with that. That is pretty difficult to do, so I would recommend doing that for a beginner there. As far as, if you notice on the glute ham, there's a bar that's horizontal, kind of a shiny chrome piece. That's where we have different positions for the thing. You're going to have to work with your patient or client to see which is best. But generally, with her, I think she's like at the third hole, which of course doesn't mean anything for you guys because every machine is different. But you want to have it so that the knees can kind of be similar to that right there. Okay? Generally, you'll see the lower leg will be somewhere angled down just a little bit like that, and sometimes usually about parallel is where you want to have it. But the movement is kind of two-part. You come up to horizontal, you're totally flat, and then you contract your hamstrings to come all the way up. And I'll tell you, this is a hard exercise. Okay? Most people who do this, it's difficult. So what I will do is to show them, I will stand to the side in a sense, kind of spot them. I'll put a hand near their buttocks, and I'll put another hand near their chest, and kind of, you ever seen that in gymnastics? Sometimes they'll show them when they're doing tumbling and stuff, kind of like that, where you come up like that and help them to get the movement. Most people, what they do when they do this, and I'll show some other things in just a second, one of the things they'll do is not come up far enough. You got to really get those hamstrings to contract to come up. But this is a great exercise because you take someone like me, it's actually easier for her to do it than me because I'm 6'1" and I have a long torso. So for me to get my upper body up there is kind of difficult. And she'll laugh at me. She'll rep out 20 reps, and I'm struggling at 10 and 12 to do that. But it is a hard exercise to do. This is one of the things we see a lot of people do is they will contract their knees, or they'll start to contract the hamstrings before they even get their body up. So they'll get the parallel, but to get the parallel, they'll contract their knees. I like people to get the parallel or horizontal before they contract those knees, okay? And that's a big thing because you're going to get more of a contraction. The other thing, too, is that you find is that when you don't contract your knees, or you do contract your knees too early, you don't get enough of the gluteal contraction, okay? So because just like in a hyperextension where someone's extending, if you have a client lay on the floor, you can actually watch the level of contraction. In most cases, when they bring that hip into hip extension, the leg, the hamstrings will contract first, the glutes will contract second on that side, and then the lower back muscles on the other side will contract, and then it go up like a zigzag pattern up the spine. So we want to make sure you get a good gluteal contraction because as you bring up the leg, the upper body to flex the knees there, you won't get as much of a contraction with the butt. So you want to get it here, and that's very important. And then here at the top, I see a lot of the athletes will do, and people will actually sit back at the top. They'll kind of sit back on their buttocks there. You want to keep a nice tension. And, of course, on the way down, that's another thing, too. You can also go slower if you want to develop some more of a tension on the hamstring muscles there on the way down. The other thing, too, a lot of people don't realize, if you look at her feet here, okay, and even though she's doing bad with the hips there, you get a tremendous calf contraction with this exercise because you're pushing against that toe plate that they have right there, okay? And so I will actually can make my calves sore doing this exercise than I do calf raises. But it's more of a functional exercise than a calf raise. Now, I do calf raises, don't get me wrong, but when you are contracting those calves like that, you're combining it with knee flexion and also back extension at the same time. So you will get a good calf contraction with that. Okay, hyperextensions, very similar to as far as the glute ham raise, okay? But in this case, here, her knees are still below her thighs. Sometimes you can have the knees at the thighs there. And that piece where her feet are on my machine can actually go up and down. For this exercise, we just kept it the same. She's starting over, leaning over. Now, in this case, the bar on the position here is further forward if you do it on a glute ham raise. If you do it on some of the machines out there, you'll see hyperextension machines that will actually be just set as it is, so you don't have to worry about that. There's, of course, other ones that, of course, are 45 degrees. A lot of gyms seem to have that. Why they started doing it, I don't know, because when I started lifting back in 1987, I never saw those before. All the gyms I worked out at always had the regular horizontal type ones. And then for some reason, I think it was Cybex or Hammer Strength started coming out with the angle ones. And if you actually think about it, it actually makes the exercise easier, which is kind of what Hammer Strength does as it is anyways. It makes the exercise easier. But don't get me wrong, I like Hammer Strength stuff. I don't use them personally. I don't have them in my own gym. But I think they're good for people who need to get some introduction to weight training. But again, doing that isn't quite as functional. But if you have someone who's a little nervous, start them out on that angled one. But see if you can work them in doing a horizontal, because obviously by the laws of physics, you're going to have a greater contraction on your lower back and butt muscles and your hamstrings if you do it more horizontal. The more vertical you get, obviously the less stress there's going to be on that with that. And of course, this is the top, very similar. We saw the glute ham raise in the middle part. Now this is interesting, and I talked a little bit about last year, and I'm going to talk about some more this year, is that what we find with a lot of people with lower back pain is that their ability to hold this position for any length of time is like nothing, okay? There's a test that you can do in your patients and clients called Sorensen's test, which is in the research, and what we do is we actually test people's time to see how long they can actually hold this position, okay? So what they do is they'll get up into this position and hold it, and I usually like to see people get at least a minute. If they can't get a minute, they got serious problems. And if you've got a high-level athlete, I like to see at least 2 minutes, 2 to 3 minutes as far as doing that. Now, I'll let you know I can do about 2 minutes, and that's about what I can do. I'm not really interested in going to 3 minutes. As a power lifter, I'm not holding the squat for 2 minutes. My God, if I did that, I'd probably die from a stroke or something like that with holding my blood pressure so high. But you want to try to get that. And so what we'll do actually with this exercise is I'll use this exercise more for training my lower back. So I'll put weights in my hand and I'll do it. But I always usually, when I do this exercise, I will hold it at the top for just a brief moment to almost break that momentum cycle of coming up and coming back down. I'll just hold it there. But what I will tell some people, and I want you to write this down because I don't have this in the notes, is that what we'll do sometimes is I'll take a folding chair or a chair like right here, and she'll be where she is right now. We'll put the chair right below her head, and what we'll do is we'll have the patient actually not do a full hyperextension, just get on the machine like that, and then put their hands in the chair to kind of support their upper body. So actually at that moment, they're not contracting their lower back. And then what we'll have them do is put a little timer, almost kind of like, I buy these little oven timers at the stores or something like that, put a little timer in front of them, and what they'll do is they'll release their hands, hold them against their body, and hold that position for 10 seconds. Okay, let's just say a ballpark figure. And then when 10 seconds are over, they'll put their hands back down and relax for 10 seconds. So we'll call it 10 seconds on, 10 seconds off, 10 seconds on, 10 seconds off, like that. And we'll do that for maybe a couple sets of 10 reps or something like that. And what you're doing is you're working on the stabilizing effect of those muscles to hold that position. You're building up the endurance. One of the things they found with low back pain patients is that the ability for the multifidi to hold an endurance contraction is like shot. The other thing they find is that those particular muscles are also atrophied beyond all belief. Okay? And type 1 and type 2 muscle fibers are not working anymore very well at all. So we need to work on building it. And of course you can play with that and that timing. And we'll sometimes do 5 seconds on, 10 seconds off for someone who's just starting because they can't hold it for very long. And then as they get better, we'll reverse the trend and maybe go 10 seconds on and 5 seconds off. Okay? Or even 3 seconds off. I'll tell you, when they're doing that, they're sweating. Because you're only taking 3 seconds rest between each rep. It's not long before you're really sweating. And then one progression we'll do even beyond that is we'll start incorporating arm movements while they're holding that position. So what I'll have them do is just go through basic arm movements while they're leaning over like she is I'll have them bring the arm out to the side, nice and easy. And then bring the arm out to the side here, and then bring it up to flexion, and then bring it up to flexion, and then bring it back. And doing that, you can even go further beyond that and add little dumbbells in their hands to do those. Because if you're holding that position and you need to watch them, and they're bringing that arm out to the side like that, obviously they're changing the weight that's on that side of the body. So if you see them start to rotate, you got to tell them to keep stable. What their goal is to do is to keep that trunk nice and stable while that arm goes out. The trunk shouldn't even change. Okay? But of course, these are all progressions that you can do with this exercise. Now my wife's a little bit shorter, so with her we had to put something else on top of the chair so she can rest herself and not have to lean all the way down. Because you almost want to have, when their hands are resting like that, you almost basically want to have them at the parallel position. Okay? So they're not having to go up and contract, they're basically holding it. The second thing is before they do each contraction, if you're doing it that way, or even when you're doing this exercise, tighten those abdominals. One of the biggest things I talked about last year, especially not training with a belt, is to contract your transverse abdominis. Okay? And I'm not the first powerlifter to squat 700 pounds without a belt. There's been many way before me. And a lot of times you'll see that as far as with the lifters from Eastern Europe, especially the old weightlifters will do that. One of the guys from Ukraine, Victor Nalikin, was back in Japan this last August for the World Games where I was at, and he squatted 880 with no belt. This guy's 47 years old, okay, and he lifts in my weight class. And I'll tell you, it's amazing to watch that guy lift. And he deadlifts 804 with no belt, but he's got the ability for his trunk to contract and hold that position like that. So we need to work on that in doing this here. Does anyone have any questions about that work exercise I was just talking about? Yes? Yeah. Yep, you do it on a Swiss ball. Of course, their body's angled a little bit, but you could also maybe elevate their feet a little bit, put it on a block or something. The other thing, too, is what I did this summer is I put together a football camp for the kids, and I coach a 5th and 6th grade football team in Fort Wayne. And for the kids in the team, I mean, kids nowadays are way out of shape, so I put together a little 2-week football camp for them. And we did hyperextensions on the ground. And so what I did, I had the kids alternate, and so one kid would hold the other guy's heels, and the kid, I would just have him just come up maybe a couple inches just to get a little bit of extension and do that. So you can get as low tech as possible with that. The other thing sometimes people will do is, of course, do this off a bench press, where the body will be on the bench press and they'll be leaning off of that. So you can even do that exercise I was talking about where you're leaning over, holding your hands, do that, put your hands on the floor, your body's on the bench press. Well, the other thing, too, I'm glad you brought that up, made me think. The other thing, too, I talk about range of motion of the lumbar spine. Okay, you got 30 degrees of extension here. She's at 0. Okay, so she could actually go another 30 degrees. All right, and we'll talk about that in this next picture. She's got increased extension there, and right there, she's going a little bit beyond as far as probably where her limit is right now. But I had a situation. I used to work out at a Gold's Gym in our town before we built our own, And they had one of those angled hyperextensions, so that's all I had to use at that point. And I was probably going about 5 degrees past, neutral. So I was going, +5 as far as extension. And one of the trainers, a young lady, came up to me and she says, she didn't know I was a doctor, and she said, "Do you know you're doing exercise wrong?" And I said, I didn't want to get cocky. I said, "Well, why is that?" I just wanted to listen to her. She goes, "Well, you're leaning back too far. You shouldn't even really come up to horizontal. Just come up to a little bit below that." I said, "Why is that?" "Well, that's what I was told." And I said, "Well, do you know why you can go to where I was doing?" And she said, "No." I said, "Well, I'm a doctor of chiropractic," and explaining what's going on. I said, "You normally have 30 degrees of motion, so you should be able to be safe to train within that 30 degrees. Now, where you get unsafe in training in that 30 degrees is when that vertebrae is not stabilized. If your multifidi and your fascia are doing their job in your lower back, you should be able to go 30 degrees with no problem. It's when you don't have that strength that all of a sudden, as you go into extension, that vertebrae tends to come forward like that and jams those facets and those nerves and eventually causes disc degeneration that you have problems."
What if there's a joint restriction in the lumbar spine?
Sure.
Is that okay still to go up past 0?
No, well, you have to assess, of course, where they are with that. Are you a doctor? Okay, so you know what you have to assess as far as their range of motion. But the other thing you can do, too, is also take patients who are in pain, and I'll tell them I want them to work in the pain-free zone. So let's say they go back and she's leaning down at the start of the hyperextension. Let's say they can only come up 45 degrees. They can't even get, they can only come up to here and just work that zone. Because if we can work that zone pain-free, then eventually we're going to slowly get all the way up like that. But you have to probably assess that. And if you have a patient that's working with a trainer, you may want to write that trainer a little note saying, "This is how I want you to do it," or give them a call and help out with the patient there, because I'm sure the patient's not going to be too happy, going and you send them to a trainer and then all of a sudden, someone says you can come up to here and all of a sudden they come back, "What'd you do to me?" So it'd be nice to be able to assist with that. And of course, another thing I see too, a lot of athletes and a lot of people is the rounded upper back. People tend to, some reason come up like that. It's a lot of times it has to do with their lower back being a little tight there. So I tell them, make sure you get the shoulder blades back. Even if you keep your arms in your armpits like I do, I keep my shoulder blades nice and back when I do that exercise. Because you also got to realize too, you're working the entire extensor mechanism all the way up from the bottom of your toes all the way up to your skull. So keep your head in neutral, and you're even working your upper back extensors as well too. Which is why I like this exercise. It's been around for a long time, even for the old-time lifters, weightlifters, and powerlifters have used this exercise. Okay, reverse hyperextension is our last exercise here. This exercise has been around for a long time. Louis Simmons kind of popularized it back quite a few years ago. This is a machine, hyperextension machine that I built. I had one of my patients build it for me. I did make some alterations from what Louis has, but this is what we have in our gym here. My wife is short, but when I built this machine, I wanted to make sure that someone who's 5 feet tall, all the way up to about 6'7", could utilize this machine. So if you see where her hands are, there's a bar. If you look to the side bars there's actually holes. We can actually move the bar there for different height people. But basically what you're doing is you're leaning over in this machine, you're leaning over, grabbing the bar. The upper body in this case is stabilized. Now for those who don't know what reverse hyperextensions are, instead of a hyperextension where the lower body's fixed and you're moving the upper body, you're fixing the upper body, moving the lower body. Okay? So we're doing this here. She's starting straight down. Now, on the floor down there, we have some different straps that we use. The red one is a longer one. That's for me. The black one is for her and for the shorter people in the gym. And we use those. And then, of course, there's a bar there where we can stack weights on. With our machine, we usually use 25-pound plates. We use 45 pounds. They're too thick as far as diameter-wise, so they tend to hit your legs quite a bit there. We go to here. Here's the middle of the lift there. And then there's the end. Okay? You want to get up to about, again, where you were with the hyperextensions, where your body's parallel with that. Now, I do see some people that they tend to use their lower back muscles more than they use their glutes or their hamstrings. So they tend to get it'll look flat like this, but they'll have a lot of extension in their lower back. So you got to watch that. And you may want to just stand behind them. And I think the next picture, yep. My wife also appreciated that picture too. Stand behind them, and I'm not trying to talk about my wife's butt here, but if you look at it, her glutes are really nicely contracted there. Okay, I'm sure she's going to appreciate this. The hamstrings are nice and contracted there, but you'd almost take your fingers and put them on either side of the gluteal cleft, also known as your butt crack, and put your fingers there, and you can feel that contraction. And what you want to do is you want to feel that contraction before they get to full extension. Again, as I talked about the way that the progress is supposed to work, hamstrings first, then glutes, opposite lower back, and zigzag all the way up, and that's the way the progression of the contraction of the extensor mechanism works, so you want to be able to see that. If they're getting hamstring and lower back contraction but not glute contraction, then you got to really work on them squeezing those butt cheeks together. And again, just like the upper back, put the fingers between the shoulder blades, and you put your hands there and say, okay, I want you to, of course, don't put your hand between the butt crack. I I don't want you to think I was saying that there, okay? Put your hands on either side of that, and then actually as them squeeze, you want to be able to feel that, okay? Now, one of the things you'll see, sometimes people bring their legs up way too high. Again, too much extension there. And then the next thing you'll see here is a lot of times we'll see this too, is again, like the good mornings, if you notice how another picture of my wife's behind, she was shifted over to the side, okay? Here, her legs are kind of coming up, and we'll see that a lot. Actually, my oldest son, Colin, was doing that a little bit. And earlier this year, he had actually had got a helmet right above his tailbone. And even though he had a tailbone pad there, it was just to the side of that. And so with him, it actually was a practice that I didn't attend that night, and he didn't say anything about it. But then when he was squatting the next week, and he started having pain when he was squatting in the bottom of the hole, and when we were watching him do this, he started going over to the side. So just one little injury causes, and he's only 12 years old. What happens if that thing never got checked or taken care of? He could have had, and the pain may have gone away, but he would have eventually had some problems. So really try to watch as far as the people moving their feet to the side like that. One thing that there hasn't been really any research about, but some people have talked about that this exercise affords that's different than the regular hyperextension is there's obviously less compression on the lumbar spine, which is pretty self-explanatory because you're not really moving it a whole lot and you're not holding the upper body. And in some cases it can cause a pumping action into the disc. Most of you know that the disc is made of 80% water, okay? And it does have a pumping action. That's one of the things that exercise does is actually help get water in and out of it. And this exercise supposedly is supposed to help more of that. I'd like to see some research on that, but there hasn't been much. The hyperextension will do that similar too, but of course it does have a little bit more of a compression nature on the spine there to do that. So a lot of times I'll use this exercise first before I use regular hyperextensions to do. Okay, one last thing is on the glute ham raise I wanted to talk about. I actually wrote it down there, but I forgot to talk about it. There is a floor-type glute ham raise, and it was pretty funny because you can do this, again, low-tech-wise, but it is like 10 times harder, maybe 20 times harder than doing a regular glute ham raise. And what it is where the person starts, they got maybe a little pad underneath their knees or laying on the floor. They put a pad underneath their knees, and then they basically just contract their hamstrings and come up. I tried doing it. I can't do that. And I don't know too many people that can. So I didn't include a picture of it since I couldn't really provide a picture since no one in our gym could do it. But some of the higher level athletes who really work hard at it, and it's something I will, now that I got a challenge for myself to do that, you can do that. Another way of doing it too, also in that case, you'd have to have someone holding your feet, or another friend of mine uses he has a floor type pull-down machine, so the part that goes across your thigh is close to the floor. He'll lower that down and hook his heels underneath that and use that. But that's a good exercise too. Now, one thing you could do in that regard is train it eccentrically in a sense that where you would actually have someone start at the top position and then slowly lower themselves, keeping good trunk control all the way down to the floor. Again, I'm not a big fan of doing a lot of negatives, if you want to call it, in that regard, but that's something you could do here. So, this is the last picture. I'm done with my lecture. This is my 3-week-old baby doing his first bench press. We did have to red light him. We're in powerlifting. It's a bad lift because his foot came off the bench there. But I have my 2 other sons to the side with our training bar, and of course, you realize there were no humans hurt in this demonstration during the filming of this here. But I want to tell you one thing that's interesting too, and it really doesn't have a lot to do with this, but it does have a lot to do with patients and clients you work with. My wife, who last year took 5th place in the World Powerlifting Championships for women down in Argentina for Canada, she wanted to have her 3rd child, so she became pregnant back in February. So we knew she couldn't compete in the women's worlds this year because squatting and deadlifting at pregnancy doesn't work very well when you're pregnant like that, as far as heavy squatting or deadlifting. But she wanted to bench, so she went to the Canadian Nationals when she was 10 weeks pregnant and won the Canadian Nationals in the bench press. And then she continued to train through her entire pregnancy. The week before she gave birth, now in powerlifting we use a thing called a bench shirt. Some of you are probably familiar with that. We haven't put it on her yet. As a matter of fact, we're going to do that tomorrow when I get back home. But the week before she gave birth, she benched 195 pounds for 2 reps, and then she did, a couple minutes later, did 200 for 2 reps. She'd never done that much without a bench shirt. So, something in this pregnancy obviously did something to her. Of course, there are some more hormones, if you want to call it, during your pregnancy. And then that was the end of that cycle, so we started cycling her for the cycle that she gets ready for the competition because we're leaving in 2 weeks for New Zealand for her to compete at the World Bench Press Championships. And she did 175 for 6, and 13 hours later gave birth, just 5 hours of labor. And then a week later, she was back in the gym doing a nice light cycle. And then last week, she just did 187 for 4 just the other day. and that's more than she's ever done before. So I guess my whole point in bringing that up is that if you can do these things, and the baby was born perfectly healthy. Matter of fact, her father, who came to visit us, made an interesting comment that he said that of all the children he's been around, he's from a family of 18 kids, those French Catholics here in Canada, he says he's never seen a baby so strong. I mean, he's already holding his head up, and so I don't know if he was like getting a workout when he was inside of her or what, but we were also very close. I mean, as far as safety-wise, that I was very close in spotting her. If that bar even moved a half inch out of position, I was right there to grab it. I never did, but I was ready to do it. But my point is you can have someone, and this is not really part of my presentation, but you can have someone exercise through their pregnancy at a good level, but granted that they have to be generally at that level before they start the pregnancy. But you can do it, and I think she's going to write a little case study about that in some research journals to address that. So, any questions? Yes?
People who have compromised flexibility, what do you do with the exercise? Do you modify them, or do you make sure all straight down the way you have the exercise?
Well, what I do in my office is that, I'll tell people we work on flexibility first before we give them strength. So we'll spend about, 2 good weeks as far as some flexibility exercises with that. And then we'll start them on some strength. So yes, I would probably do a partial range of motion, but again, I'm not big into doing those partial range of motions because then, of course, you partially train a muscle, okay, and you're partially training a joint. But yeah, if you have to do that, I'd recommend it as they're doing it. Like one of the things about the Romanian deadlifts that I've noticed, go back to hamstring flexibility, is that actually made my hamstrings more flexible doing the Romanian deadlifts. I can almost get my palms on the floor. And there isn't too many guys in U.S. men's national championships in my weight class that can get their hands on the floor. They can probably get their hands to their knees, and that's about it. So it does actually help with your flexibility a little bit doing that Romanian deadlift. So, yes?
Yeah, I always referring back to the hamstrings, they tight for a lot of exercises. What exercises need to do at home to help relieve the tightness in the hamstrings? So then, I can practice.
You mean a strengthening or flexibility?
Flexibility, just like, there's certain things sometimes that exercise can amplify.
Right. Okay. Well, there's various techniques that I'll use in the office. There are some good hamstring stretches. One of the ones I give to my patients is where they're laying on their back on the floor, and they put their leg, one of the legs, they're scissored through a doorway, and one leg will be on the floor, another leg will be up on the door jamb, and as they get better, they can keep moving their hips closer and closer to the door jamb. One thing I do is kind of a split type of hamstring stretch where I'll put a pad underneath one of my knees, okay, and then I'll actually bring the heel in front of me so my one leg's back, and what that does, it helps keep my pelvis in the right position. Because a lot of times you'll find a typical hamstring stretch, they bend over, or they'll do a hurdler type stretch of the leg out in front, is they end up getting all this lumbar flexion. The lower back tends to really round, and they're like, wow, look how flexible I am. Well, yeah, then you lay them on their back and you bring their leg up, they can get up to 45 degrees, but they get all this flexibility in their lower back. So what I'll do is I'll do that. That's the one stretch that I tend to do. But that one you have to spend some time teaching someone how to do properly. But the one in the door jam is one that I'll use. It's very simple and low tech to do. So, yes?
Can you comment on seated back extension machines and strength?
Seated back, what do you mean?
Well, when was it seated?
Oh, those. I use that word, or I laugh at that because I refer to one of my friends in this room here, referred to the term I used last year called patient makers. And that's one of those machines that one you're talking about. Remember that, Scott? All right. One of the patient makers is that you'll find a lot of times with those machines, they'll have some kind of component with the legs too, where the legs are kind of hooked into a little machine there, and as you kind of lean back, that one's not so bad, but I don't like that because again, where in life do you sit in a chair and lean back and forth like that? You don't. But where in life do you lean over and pick a bag up off the floor? And so doing exercises that, like the Good Mornings, Romanian deadlifts, are more functional for that area. The second thing about the Smith press, that's actually when I first started lifting when I was in 10th grade. I did a little bit of lifting back in 10th grade, but then I quit and I didn't lift again until I was after out of high school. But I was so embarrassed about my bench press that, I would go to the Smith machine and I put it on there. And it was a good learning tool for that. The only thing bad about that is that any type of machine that you push the machine in its own groove, you lose the stabilizing effect of the muscles and of the body. And again, it's not all that functional. But for someone who's beginning, or someone, let's say you take a 70-year-old guy who wants to get into some weight training, that's something, hey, let's use that. It's a safety thing. Then as they progress through that and get some more strength, then let's progress into the free weights, okay? But that's where I think, and in my own personal opinion, and some of the people around here this weekend also talking, the Cybex and hammer strength and stuff like that are okay, but they don't serve really a good purpose for life. That's why in my gym, I don't have any machines like that. We have just all straight free weight stuff. Because when that grandma's going to be picking up, that 20-year-old or 20-pound, grandchild, there's no Smith machine, there's no rails, there's no cams or anything else to help that movement. That lady's got to be able to pick that up themselves. So train them that way, and that's the way I look at it. But as far as starting out, I don't see a problem with that. The one thing I will say, I don't mind so much Smith presses with the bench press, but when you see Smith presses with the squats, I don't even recommend that. I'd rather have them start out with a broom handle on their shoulders or something, because when you see them do that, you ever notice how how far back their butt is? Like if you actually took the machine out, they'd fall on their butt. Okay, and I've seen guys that would put 405 or 4 plates on either side of the bar in a Smith press, and then go over to the squat and can't even do 225 because those back muscles, those trunk muscles aren't strong enough to hold that weight and balance it. And that's a big thing, I think, as far as in life. So, yes.
Yeah, like your kids are pretty exceptional, I guess, but for young students, for young athletes and stuff, like when would you figure it would be a good time for them to start resistance training?
Well, if you have, I guess I would like to say that my wife and I are probably competent, obviously, to teach them how to do it and do it right and everything. If they have someone who's really strong supervision, we started calling when he was 10. Now, Anthony, my 6-year-old, who you saw do the squat, he actually, he has really good form. And I tell you, that kid's going to be a squatter when he grows up. We'll use a training bar with him, and then he gets excited. We'll put a 2.5-pound plate on each side, which now turns from 25 to 30 pounds. He gets pretty excited about that. But we won't let him get too crazy. He's just playing around. My wife grew up on a farm in Saskatchewan, and she was 10 years old. She was hauling 80-pound hay bales around and throwing them around. So, what's the difference between doing that, and of course that's a multi-angular type motion versus doing a squat, which is controlled. And I remember a few years ago, the American Academy of Pediatrics came out with a position paper that they recommended no weight training for people under 17. And I wrote them back, and I said, I'm paraphrasing here, of course, that's a bunch of baloney there. But my point is that here in Wisconsin at the time I was practicing, we had kids at 10 years old doing rodeo. In Canada, you have kids learning how to skate before they walk. And of course, you fall on ice, you're obviously going to hurt yourself. In a controlled, supervised situation, you can have someone, at a young age doing it. So with Colin, we started doing at 10 years old as far as doing sets of 10 and stuff like that. I won't let him go below 10. So when I get back tomorrow, his goal is to actually do 135 for 10 in the squat for the first time ever. And he did 2 sets of 10 with 125 last week, good form. And my wife is watching the side, I'm spotting from behind. He's got great form. And his performance in football this year made a big difference there too. But he wants to do this, and he knows what the benefits are. But I also told my children too that you will not do sports unless you do some form of weight training. And the 2 big things I tell with the reason for that is that number 1 is injury prevention. The stronger you make that muscle in that joint, as long as you keep the flexibility and the skills of there, the less chance it's going to get injured. And second, of course, is sports performance. You're going to increase your performance with that. So, yes.
How do you feel about run and back style? Some stuff like that for someone with weak glutes.
Run and back style as far as what?
For someone with weak glutes, as long as they don't have any glute problems.
Well, I think you're setting up an abnormal motor pattern there. I think you need to, the lordotic curve in your lower back is there for a reason. That's the way when you were born, like my 3-week-old son here, of course, he can't even roll over yet, okay? Even though he's benching 25 pounds here. New world record. But the thing is, he's going to progress to rolling, and then he's going to progress to holding his head up, and then he's going to progress to, getting into a crawling position, then he's going to crawl, then he's going to walk, then he's going to run. But we do all that because when you're born, you look inside a mother, the spine is a C shape. You then, as you get into crawling, that actually helps form the cervical and the lower back curves, which then helps form the middle back curves. So those are for a reason. So I recommend people keeping that for a reason versus training in something that it's not normally meant to do. Again, I was talking about those migrant farm workers earlier. They tend to sometimes have a rounded back posture, but they're dealing more with the ligamentous area. But you got to realize, too, they're doing a lot of repetitions at very low intensity. Okay? They're not, when they're picking up something off the ground, it's not weighing 300 pounds. So you can get away with that a little bit there. So, any other questions? Yes?
Are you familiar with Dr. Stewart's research?
Dr. who?
Dr. Stewart McGill.
Yeah, I believe you're speaking right after I am.
Some of his work, the exercise that he's shown, his work would contradict part of that.
Oh, really?
With respect to the forces placed on the spine,
Okay.
and he draws a distinction between the training but also training for performance.
Right.
And so you characterize the exercise that you provide me the patients with that as well-learned for performance.
Well, I think, I would say actually both. okay? But the thing is that you have to develop and have to have proper trunk function first before you do this stuff. I think some of the exercises for the normal lay population, if they just went in and did a hyperextension, for example, it'd probably be bad for them. Before I let someone do a hyperextension, I want to assess as far as how their range of motion of their hips are, how their trunk is working, how can they even contract their transverse abdominis, can they contract those? If they can do all that, I don't have a problem having them do that for a health reason, to keep their back healthy. As far as cycling, and the other thing too, I will cycle these exercises. So, you know, I won't do, let's say, hyperextensions. Like I cycle glute ham raise and Romanian deadlifts. I won't do both in the same workout. You know, so there's not always, the other thing too, you find a lot of people when they work out, and you may have seen this a lot, is that people will do the same exercise for like, 3 years. Same reps, same everything. Two things I see, several things I see wrong with it. One, I tell people take a break every 8 weeks. Take a week off from your lifting. And second, cycle your exercises. Do something different. You know, I think when you have people that do it, when you have someone who doesn't have a good trunk strength and they don't cycle exercises and they're already just, poor, healthy lifestyle, you should be doing some of these. Okay? So I probably have to agree with Dr. McGill in that area. But I also do believe that some of these things can be done if done properly. So, you have a question there?
Yeah, I agree with you with everything you said about the squats, about your femur coming down parallel. But I looked at the stuff the last half year, especially the references. I had a discussion with a friend of mine, and a bunch of the references said don't go low because of their concerns about the articular cartilage that's exposed when you get into more knee flexion.
You're talking about the knee?
Yeah,
right.
The knees, because of the patella being and cartilage. They were more referencing, especially knees that already had a problem.
Right.
But, I mean, I agree with you that that's fine, but they were saying not to do it. Why is that not a problem? They said it is.
Well, one of the things that the old theory was that you don't let the kneecap travel in front of the toes. That was the old theory. But if you have someone that's got good knee flexion, good flexibility with their quads, and you can do that. And actually, if you understand the mechanics of how the knee works and the way it bends and how the condyles work, it actually is okay as far as getting into that position, okay, and coming out of it as long as the knee has been healthy. But if you take someone who's 60 years old and who played high school football and damaged their knees and all that kind of stuff, no, I probably wouldn't do that. But I would also probably work on other exercise, maybe do a sort of a lunge or something like that, or a step up. You got to work into it. It's kind of like the lady said earlier, if you do partials, yeah, you can do partials, but eventually with your goal of getting a better range of motion with that. When you watch, now powerlifters, the general idea is to keep the knee behind the toes and actually to keep the tibia almost as straight as possible, maybe a little bit forward lean to it. But the thing is, you watch Olympic weightlifters, my God, if you actually break it down film by film or frame by frame, you'll find that knee travels almost like 4 inches in front as far as the toes. And they don't have knee problems, okay? Now, Chad Akay, who was here yesterday, I don't know if you guys were here last night watching Dr. Leahy's demonstration of the snatch, he said he had his right knee scoped, but he also had an injury to that a while back too. So it wasn't necessarily dealt with as far as with the lifting aspect too, but you got to do that. I started doing a lot of front squats about 2 years ago, and I'll tell you, I had to really work as far as on the flexibility, because I'll tell you, my knees were sore for like 3 weeks, but that was also the tendons and the ligaments getting used to that motion, and now there's no problem with it, but I had to get used to it. Whereas you take someone like Colin, my 12-year-old, and got him doing front squats, and I'll tell you what, he wouldn't have a problem doing it because he's got plenty of flexibility. So, okay, we got time for one more question here.
Well, actually, it's not really a question. It's more of what you said. A couple of years ago, you did some work in here.
Right.
You're specializing in knees at the time.
Right.
And I'd asked you a bunch of questions. I did a motorcycle, and my knees were really hurt. And we were talking about slowly using the Swiss ball to learn myself to keep myself go deeper and deeper.
Right.
To help rehabilitate as well. I squat pretty much rock bottom now.
Good.
And no knee problems.
Excellent. Good job. All right. Thank you very much.